Another question what we notice in our day-to-day practice, like every day, whatever patient we are seeing, same kind of patient coming with different kind of MRIs or X-rays. So like patient who have a neck pain or back pain, same group of patient, we have seen their X-ray or MRI is showing absolutely normal, near to normal, but they have horrible pain. And another group of patient, their MRI or X-rays are showing it's horrible, but they don't have that much pain. It's very less pain, mild pain. So that makes us curious that why it is so that structurally whatever we are seeing through X-ray or MRI, it is not in their presence of mind. So when we dig a little bit deeper of this kind of patient, what do we notice or what do we see, that they have some emotional baggages. Might be they have lost someone in their family or they have some economical issue. So they impact their body in a different way. So these kind of problems also not cured by the medicine. But when we start working energetically, we start feeling the changes. So could you please explain about that thing, like what is energy osteopathy?
All right, big topic.
Yep.
So let's talk about the person that comes to you with lots of pain and negative studies.
Negative MRI X-rays.
Negative studies.
Yeah.
I always tell them the same thing. I said, if they know why your ears are ringing, it's bad. Okay, you have an AV malformation, you have a space-occupying lesion, tumor, cancer, something terrible. If the studies can show it, studies are good at showing big things. So I said, the fact that you have this problem and they don't know why, let's be happy about that. They look at me with that look. Because if they said, you know why your bowels are wrong? Because you have a bowel cancer. It's a bigger problem. I might actually be able to help some of your symptoms, by the way, but you have cancer. So one, I want them to understand that. I understand the frustration. They've gone doctor shopping everywhere. Why? Now there's some people walking around that have herniations and they have no complaint at all. Yeah. And it clearly tells me something. The thing it tells me is pain is multifactorial. So you look at the patient who has a complaint, they got L5 herniated disc, there's MRIs. Back in the old days when things were film and not digital, there's a big red circle around this with a dot that the radiologist put. Okay, I see it, everyone sees it who's looked at it. The radiologist says, there's your problem. And when you go to the orthopedist, they agree, there's your problem. The neurosurgeon says, yeah, there's your problem. Okay, yes, that's a problem. I'm not unherniating your disc, but there's other factors. One, if you have a herniated disc, well, the stuff that comes out is a neural irritant. What comes out of the disc, the nucleus pulposus, that dries up, desiccates in about a year, year and a half. You're gonna have edema around the area, swelling, probably, because you got the herniated disc and you got pain. That's going to further compromise the neural foramina. For those that understand the anatomy we're talking about here, it's going to irritate the nerves by closing the neural foramina. Will muscle spasm because you have pain? Yeah, that'll probably close the neural foramina. You're probably not sleeping well, have some anxiety. This is going to add to your problem. And then there's the rest of our life. Your social factors, difficulty with family, difficulty with work, and now it's pushed you over the top. Can I change your family? Probably not. Okay, can I change edema? Probably. I could probably make some impact on it. Is that going to be some piece of your pain? It may be a big piece of your pain. Can I change the painful hormones that are now being secreted? Maybe, by getting the edema down. Can I change some of the spelling? Some of the some of the spasm? Probably. These are factors. Can I get you sleeping a little bit better, bring down the anxiety? You might be out of pain, or maybe significantly reduced. So if I use my pain-o-meter, this is you with no problem. This is you going, I suddenly have back pain. It's not like we're here, okay, like you're a newborn and everything is wonderful in the world. As adults, we're somewhere here. I lift something and it goes from here, right here, and I go, you know what? I know what it was. I lifted something, felt the pop, that's it. And for some of us, it's just getting to hear, and my back's hurting. What happened? Did you have a car accident? I don't know. just started hurting, it's been getting worse. So pain is multifactorial. So someone can have a herniated disc. Apparently, that doesn't mean they're normal.
Yeah.
They're just not having pain. That person has a herniated disc has to be cautious when lifting things. I don't know if I answered all your question or a lot of it.
So then, that's it.
Yeah, go ahead. I'm ready.
So when we start reading about the chronic pain or chronic pain management, so what we understand that acute pain, when you got some injury, there will be some acid formation, which you call recurrent acid, which is very much sensitive to your nerves. The pain medication, NSAIDs, whatever we are using, they just block those signals or chemicals. Your pain threshold goes down. But in chronic pain management, it's totally different scenario. Like people who have a lot of anxiety, stress, sleep depression, and all these things, their limbic system start processing those things in a different way, like the physical pain and the emotional pain. Your limbic system is processing the same way, so your brain is going into hyper alert mode. So what I was thinking, like people who have acute pain, if those nerve receptors in your peripheral joint, in your ankle or somewhere wherever you got the injury, instead of focusing on those areas, why don't we focus on the brain where your inflammation got controlled? So can you do something about that? Like instead of focusing on the local injury, local area where nerve got irritated or those fibers got irritated, accumulation of acid formation over there, instead of focusing locally, why don't we focus on centrally through the central nervous system, like which control
Okay,
our
understood. I don't see a reason that focus on one changes the focus on another. In other words, you come in and say, my ankle hurts. If I don't touch your ankle, you're gonna make my life a living hell. So I have to do local things. Otherwise, it's just gonna be difficult with our relationship. I say, no, just wait me out. I'm not gonna touch your ankle, I'm gonna do X, Y, and Z. So there's what we gotta do medically, osteopathically. Then we're dealing with a human who has certain understandings. My ankle hurts, I demand you touch my ankle, okay? And finding local things, everyone's gonna find it. You see, my shoulder hurts, everyone and their uncle can find a problem in the shoulder. So I'm gonna do something locally. When you say focus on the brain, well, would I focus on the brain because this is controlling inflammation? I wouldn't. What I would do is I would go all around the whole body where I find restriction. At some point, I am on the brain cranial mechanism. Anyway, in my particular way that I like to do osteopathy, I look at the whole body. As I said, osteopathy has really gone in the direction of looking at individual areas and focusing on that. So while the brain may control it, I have to feel something in that system that doesn't feel right to me. To operate on a normal system doesn't seem efficacious to me. To touch that system and go through the vault and do releases and find everything's fine, that part's gonna happen really quick because everything's fine. If I feel it and it's not fine, I found it when I got to that system. So I'm gonna look at things, key lesion, and then I'm gonna very quickly divide the body into regions and look at things regionally. And absolutely gonna touch the ankle so that I can skip the 5 minutes of, doctor, why didn't you touch my ankle?
Yeah, that's a very important aspect because sometimes when we are treating patients, so they also ask this kind of question that I have a problem in my shoulder, but you are checking different part of my body. Or I have an ankle strain 3 weeks back and you are checking my hip, you are checking my iliotibial band and other part of my body. So yeah, this is really helpful. Whoever is watching this video, hope this will help them to understand also why all these parts are very important.
I told you there is medicine, what we're doing, and if you gave me your computer and said, hard drive's got a problem, fix it, replace it, and I don't fix it, I don't replace it, you want your money back, and you're entitled to your money back. I said, I can fix this. I got a shoulder problem, no. There's no guarantees with that. I'm gonna work to the best of my ability, but I wanna make our relationship simple, non-combative. So you come in with back pain, doc, my back hurts, this happened to me. Okay, back pain is the #1 reason why people see anyone for treatment. Number 2, neck pain, and if we add in
Migraine headache.
if we add in headache, cephalgia, and neck pain. So I ask people, okay, you're back, tell me all about it. Does your neck ever bother you? Well, yeah, but I'm not here for that. You get headaches? Yeah, I get headaches once a week. I'm not here for that. I ask about it, and I ask about two other common things: headache, neck pain, back pain, sleep, and bowels. For an North American population, IBS, irritable bowel syndrome, meaning negative colonoscopy, negative, no Crohn's, no ulcerative colitis, no medical worries, no reason for your diarrhea and constipation and abdominal pain. It's 20 to 25% of Americans that would have this complaint. So I ask it, how's sleep? Difficulty falling asleep, staying asleep, or both? If they say falling asleep, is it because you can't get comfortable or because you're thinking about stuff? If it's because you can't get comfortable, that's musculoskeletal. Maybe I can help that. Because you're thinking about stuff, it just lets me know you got other worries going on. I don't need to know what they are. I just know it's a factor. If I say, are you staying asleep? And you say no. Are you getting up to pee 72 times a night because you're diabetic or whatever? That I might not change. If you're getting up because you're uncomfortable, that I might be able to change. So I've asked about 5 common things with the adult patient, different things with the child or newborn, so that in our patient relationship, after a few treatments, and I don't do 10, 20, 30 treatments like some people are recommending here. Okay, I do a couple of treatments and then I expect to see some change, either resolution or that a few treatments was worth it. Then we can decide if we need to do more. Not 5, 6, 7 expensive treatments from me and nothing has happened at all. So I ask all these other things because when you tell me, well, it doesn't feel any better. You're going all around my body. Why are you doing this? One, your ankle's a problem. I touched ankle and I touched other things. But you said you have headaches once a week. That's my reason for that. You said my stomach's not so good. It helps back up my reason for the way I want to work. And I'm going to work the way I want, not the way you tell me. You do not know how to make yourself better. And neither does the other osteopath, chiropractor, MD, acupuncturist, whoever it is you saw before. You're here now because you still have the problem. So getting the patient history, it makes patient handling much easier. Oh, see, your headaches aren't so bad. See, you said you're sleeping better. Something in your overall picture is changing. People tend to reduce things to, my life is bad and it's all terrible. And then if you make some of it better, like my life is still bad and it's all terrible. And then if you go back to it and you have this information, it's not all bad, it's not all terrible. Some things are changing. There's the psychology of dealing with a patient, which is not taught to us in osteopathic school. It's definitely not taught in medical school. There's no testing for personality for the people coming in applying to medical school. You are dealing with people's intimate problems, physical and emotional.
Nowadays, what I saw, what I feel like, there are very few doctors, not only India, all over the world, whatever doctors, I came in touch with them. Very few of them is going deep core into the medical problems. Most of them are like masking the problem. You have pain, just have painkillers. You have this issue, take that, take this, and take that. But yeah, definitely, genuinely, there are few doctors, they really work hard to cure the problem. They are seeking for the health. So where do you see the future of osteopathy? Because I believe there are always some good people.
Well, the future of osteopathy, we'd start to talk about different countries probably. Mm-hmm. So in Western medicine, some of the drug companies have a budget equal to or greater than some small African countries. That's a fact. Mm-hmm. They have more money and more budget. So my wife and I, we watch television in America. 2 out of every 3 commercials is for a drug. So in America, if you're asking your doctor for, instead of talking to the doctors, they weren't allowed to advertise 30 years ago on TV, 40 years ago. Then, because they have a lot of political influence, they can advertise. So the drug companies are direct advertising to the patient now. So if you go in America to your doctor, you say, I'm having allergies, I want this drug. Okay, if you're not asking for narcotics or controlled substances, you want something for your sneezing and allergies, and you have no contraindications for it, It's very simple. You ask for it, you're getting it. Okay? And it's coming from the patient asking for the medicine. Whereas the way it used to be is they're advertising to the doctors, sending the drug reps to us and telling us why this medicine's better than the next one, giving us free samples to give to patients. They're still doing that, but they're going to the patient and pushing it. Ozempic. Look at all these people in Hollywood that suddenly look like skeletons.
Yep.
Okay? Whether they want to admit it or not, plenty of them on Ozempic. Myself, I'm 64. I need to lose a bit of weight. My doctor, who's excellent, and also a friend of mine and a colleague, on my checkup, my numbers have just crossed over into diabetic numbers. He said, you want to think about going on Ozempic? And I said to him, as I said, he's an excellent doctor, a colleague, and a friend. And I said, I'm not current on these types of medicines. I've been doing manipulation for so long. I said, what's the downside if I take this medicine? He says, well, you need to exercise, and I'm 64 and lazy. I said, why? Why do I gotta exercise? He said, well, because you lose muscle mass. And I said, what? Because everyone's looking for the magic drug. I want to lose weight. Yeah, I'd like to lose weight without changing my diet, without exercising or doing a darn thing. He said, most of what you will lose will be muscle mass. At my age, I want to lose muscle mass. I'm trying to keep what I got. I wish the fat would go away. And I'm trying with dieting and so forth. But in other words, it's being marketed as a magic pill. And it will cost you thousands of dollars a month. Oh, you won't have to pay it. The insurance company will pay it. But you're paying for your insurance through taxes, through work. Okay, so there's so much money to be made, and the push is coming in the West, and it's bleeding over into Europe. I see it in other countries that I'll just leave nameless. The wealthy countries that can afford these medicines, it's all being pushed. I believe in the United States, there's political factors involved in this. I believe in other places that doctors are not doing it for that reason. I think they're following the West, thinking that we know what we're doing, or we're doing it for the right reasons. So just giving somebody a prescription is an easy answer to their question. And if the doctor has a belief that this is working because journals are telling them that it's working, even though 30 years later they'll admit that they're lying, I don't believe the doctors are poorly motivated, that they don't want to see somebody be well. They want to try and answer your complaint. I have pain, here's a painkiller. Okay, it's path of least resistance. I believe doctors are not immune to being lazy than anyone else. And then there's also patients. A lot of patients, at least I'll speak from the West, they're highly motivated to do nothing but take a pill. And the advertising that they see that billions are spent on is telling them, you don't have to do anything about your lifestyle. You don't have to do anything about your mood. You don't need to talk to somebody psychologically about terrible things that have happened. You just need the right pill. You need the right chemistry in your head and you'll be happy. Right chemistry in your head, you'll have a six-pack abdomen.
So don't you think doctors are now a little bit deviated from their mainstream, or like, what is the health?
Absolutely. 100%. The doctors are not saints. They're people just like anyone else. This is an illusion from my parents' generation. The doctor can do no wrong. And maybe they did feel differently then, and they didn't have the pharmacology, all of it, like they have today. My parents believed different things than what people believe today. When you hear advertising 24/7, we heard advertising, we grew up watching TV, they said people were watching TV 5 hours a day and it was terrible for you. They're estimating that you're on smart devices 10 or 11 hours a day. Start doing your homework and figure out how many hours you're conscious. If for 10 hours a day you're seeing advertising through your watch, your phone, it works on people. Propaganda works on people when they hear it constantly.
Yeah.
The patient is being inundated with it, so is the doctor. Do you think you're the only one who's on your phone 10 hours a day? You think you're the only one playing a video game for hours a day? Doctors are doing it, everybody's doing it. It's almost like, if I want to take a fantasy movie, like The Matrix. Everyone's going to sleep. Now enter AI. a new way to cheat for high schoolers and middle schoolers. A teacher's full job now is trying to figure out how they're cheating, how they're using AI to cheat. My generation, we had to copy something out of a book, and the chances were pretty high you could get caught on that. So, a doctor's not, it was a profession that attracted a certain kind of people, and then it attracted people for money, for status. It still does. People are essentially lazy.
That's a sad story.
People are essentially lazy. Path of least resistance. Should doctors be taking more care of their patients? They should. But if they're having to see more people now, to push more drugs, as a therapist, and this is another reason why PT, RMTs in Canada, this is a perfect continuation of osteopathy, is the contact time you have with the patient.
Yeah.
So if you're having a half-hour contact time, that's a lot. If you're a doctor and you have 5 minutes, what can you do in 5 minutes? They're being asked to see more patients and make less money in the West. The money goes to drug companies. It's not going in doctors' pockets anymore. You know, it could be a doctor, have 2 Mercedes and a big house on a hill and retire when you're 60. My parents' generation. You're going to work double hard and make less money and more aggravation, more paperwork, more lawyers, more insurance in the West. So if you have 5 minutes to see somebody and write a note and be legally responsible and have a lot of people waiting to see you make a mistake, what are you going to do? You're going to give them easy medicines. I don't blame them for having fallen into this trap. Yeah. Investigation takes some time. People don't want to pay for that either. You want this amount of time, pay for it. They still want the same result. They want it quick. They want it now. That's the West. And that idea is following around. So I see the future. I see the future as bleak in many ways in that regard. I see it good for the few artists that are around. You really want to learn how to treat the body, how to listen to the body. That skill is not gotten everywhere. You want to crack necks and backs, it's everywhere. From people with improper training, people with proper training, people that are totally unscrupulous. As I said, 350 rupees, $2 in Egypt, $5 in Saudi. Okay, from someone who may or may not know what they're doing. You want to really fix my long-time chronic problem? I want you to spend some time with me. I want you to find something wrong with me. You have a better chance. 5 minutes, you don't have a chance. Don't have much of a chance. 5 minutes, that's all you can do. Maybe it's a Band-Aid for a few days.